Atrial fibrillation is the most common arrhythmia. It occurs in 1% of the population by age 60 and 8% by age 80. It's characterized by chaotic electrical circuits in the top chambers of the heart, and if not treated properly, can lead to palpitations, shortness of breath, heart failure, stroke, and even death. People experience palpitations all the time. Sometimes these palpitations are as simple as a skipped heartbeat. Other times they're more sustained when people have atrial fibrillation. Some people describe it as a fish flopping around their chest, and they may notice that routine tasks like walking the dog or climbing a hill, they become extremely short of breath. If there's any doubt in your mind, you should contact your physician to investigate further. The treatment of atrial fibrillation is complex. The first issue is stroke prevention. Before we decide on a treatment plan for an individual patient, we carefully assess their risk for stroke with risk factors such as hypertension, diabetes, age, vascular disease, heart failure, or history of a prior stroke. If they have any of these risk factors, they're often treated with blood thinners such as Coumadin, which has been shown to reduce the risk of stroke and death in patients with atrial fibrillation. The second issue in terms of treatment of atrial fibrillation deals with symptoms. In some patients, medications are very effective at controlling symptoms associated with atrial fibrillation. There are two types of medications that are used, some that control the rate, others that prevent the rhythm completely. Unfortunately, this approach sometimes fails, and we turn to another procedure called atrial fibrillation ablation. Atrial fibrillation ablation is a minimally invasive procedure that prevents this arrhythmia by targeting its triggers. These triggers occur in the pulmonary veins, which are responsible for bringing oxygenated blood from the lungs to the heart. To achieve this, we place a catheter in one of the leg veins and thread it through to the heart, and then under imaging, direct the catheter to the openings of the pulmonary veins. There, we deliver energy to isolate the triggers that cause this arrhythmia from the rest of the heart. Atrial fibrillation ablation occurs in a special electrophysiology lab. Here, we have equipment that helps guide us through the procedure. The procedure occurs under general anesthesia and usually takes about 4 to 6 hours. Patients stay overnight, go home the following morning, and feel themselves within a day or two. By 1 week after the procedure, they're up and running doing full exercise.